All right. Let's see. I'm going to admit everybody. All right. Okay. Good afternoon, everyone. This is our first quarter policy guidance webinar for 2025. We have a lot of letters to go over. So my name is Karen Skew, and I'll be just kind of hosting this webinar. And we have 5 different sections that we're going to be covering today, and I'll kind of go over those with you. So a few things before we actually get started. One thing is this webinar will be recorded. So if you do have an objection about that, you can just please let me know in the chat. A copy of this webinar will be available after the presentation. I posted on our website. There is a link to show you where to go at the end of the presentation. I did send a copy of this PowerPoint presentation to everyone that was registered as of yesterday. So if you did not receive that, my contact information is below. You can send me an email and I will make sure to send you a copy of this presentation after the webinar. All right. So this is what the agenda looks like today. As I mentioned, we have 5 different categories of letters. So we're going to be talking about the recent ACLs to support small counties. We're going to talk about reunification and termination of parental rights. We have resource family homes, permanency, and then our last category is other and miscellaneous. On the right side, you can see the letters that we'll be discussing. The links to the ACLs or ACINs are included in the presentation. If you'd like to kind of follow along with that, you're welcome to do so. You can put questions in your chat. You can also kind of raise a hand if you have a question, and we'll keep an eye on that to make sure that we address all of your questions, and feel free to reach out to any of us after the presentation. There's contact information at the end of each slide. And then there is also a contact slide and a room for questions at the end of each letter. All right, I'm going to go ahead and advance to our first category. So this category is talking about the recent ACLs to support small counties in assessing state programs and resources. We have one letter, ACL 2490, and this is the Family First Prevention Services Program, Flexibility to Small Counties for Prevention, and this will be presented by Stacy Kinney and Monica Vasquez. All right, when you're ready, go ahead and let me know if you have any questions.
Hi, good afternoon. My name is Monica, and I'll be covering ACL 2490. This ACL is specifically for the Family First Prevention Service Program, those counties that opted in or were interested in opting in. So there's a few key components to this ACL. The first one is the state block reappropriation, and then the second is the small county work groups. The small county work groups are a result of a work group that met around 2 years ago, and they discussed what were some challenges and solutions in regards to opting into the FFPS and the completing a comprehensive prevention plan. Could we move to next slide, please? So this is in regards to the state block grant reappropriation. Initially, the the due date or the expiration date was June 30, 2024. However, this date has been extended and now we have 4 additional years. So it's now June 30, 2028. Counties that opted in to the CPP and have an FFPS program, they can use the state block grant funds for prevention and strategy services. So now there has been that extension of 4 years. Next slide, please. And now we're going to go ahead and talk about the small county flexibilities. One of the things that came about when we had the small county work groups is that they were struggling with having evidence-based programs given the limited resources or capacity issues. So what we went ahead and added in statutes that the small counties are allowed to apply for an exemption. This exemption would allow them to have a CPP and participate in the FFPS program without having an EVP. If a small county is interested in this exemption, they would just need to update their CPP by emailing us, and the ACL provides several questions that they would need to answer. The questions are regarding reason why they can't have an EBP, if they plan to have an EBP in the future, and making sure that they've talked and met with their governance structure and everyone's in agreement with it, applying for this exemption. And that would just be emailed to our FFPS mailbox. Next slide, please. With this new exemption, we decided to give those counties that didn't apply to the FFPS program a second opportunity. So this is specifically for counties that are interested in the FFPS program. They are able to apply again for the first time by submitting a letter of intent by March 31st. And then we will need their CPP submitted by December 1st. If a small county is interested in the program, we encourage them to send us an email so we could set an appointment to review the components that are required and inform them exactly where we are in our implementation stage and the advisory committees that are available for them to join so they could be on track and understand where we are with the implementation. Next slide. Another thing that came from the work group was that counties shared that they were not able to meet the requirements that had been set for the Family First Transition Act regarding using at least 50% for prevention and early intervention. So that was lifted for those small counties. And now the small counties are able to use the transition grant for any permissible purposes described in ACL 2147 without that condition of using 50% for the prevention and early intervention. Next slide. Okay, so that's the main components of this ACL. If there's any questions, feel free to reach out to our FFPS Prevention Services mailbox. I'm not sure if anyone has questions for me right now. Not seeing anyone.
Okay, thank you very much, Monica. If you think of a question after we go to the next section, feel free to send these questions and we can follow up after the webinar. So thank you. We're going to move to our next section. This category is under the reunification and termination of parental rights. We're going to be talking about two letters in this section, ACIN I-5924, the cadency ruling letter presented by Heather Yetter. The second letter will be ACL 2464, a parent's failure or inability to participate in court-ordered treatment programs, not evidence of detriment to return or reunify, presented by Todd Graff. So Heather, whenever you're ready, you can go ahead and begin.
Sure, thank you. In the Cadency court ruling, discusses the parental benefit exemption as labeled in the court ruling when considering terminating parental rights. This ruling interpreted Welfare and Institution Code 366.26, little c 1, large b 1. Can you go to the next slide, please? The parents must prove 3 elements to establish the exemption. 1 is regular visitation and contact. 2 is a relationship, the continuation which would benefit the child. And 3, the termination of parental rights would be detrimental to the child. Next slide. The county social worker shall document in all pertinent court reports consistent and regular contact between the child and the parents, whether such contact has developed a substantial positive emotional attachment, and whether the termination would be detrimental to the child. Next slide. In the case of an Indian child, the child's tribe should be consulted regarding any recommendation to terminate parental rights and whether the tribe believes it would be detrimental to terminate the relationship. This ACN is for informational purposes, and the department does not have further guidance since the Cadency court ruling is case law, and we cannot advise on the legal aspects. The department wanted to release information about this court decision just so everyone is aware. However, county social workers should consult with county counsel regarding the specific details of this case. Go ahead with next slide. I think that was the end of it.
All right, thank you so much, Heather. If you have any questions, go ahead and feel free to put them in the chat. Otherwise, you can go ahead and reach out using the email address provided. Okay, I don't see any questions. Thank you, Heather. We'll go ahead and move on to the next letter in the same category. This is ACL 2464, and this is presented by Todd Graff.
Hi, ACL 2464 was published to announce the passage of SB 463, which amended some WIC codes regarding the presumption of detriment based on a parent, guardian, or Indian custodian's lack of participation or substantive progress in a court-ordered treatment program for purposes of determining whether the child should be returned. These amendments eliminated the presumption that a lack of participation in these services is prima facie evidence of risk, but it still requires the assessment of the totality of circumstances surrounding the parent's ability to have the child safely returned home. So instead of just checking a box that the parent didn't make any progress on their court-ordered service plan, the court now has to look at the entirety of the case, because there can be a lot of valid reasons why a parent couldn't make the court-ordered service plan work within the time frame given. So I guess next slide. So again, this was just kind of to highlight that while a parent or guardian's inconsistent participation in the treatment may be a concern, it is not in and of itself an indication of substantial risk or detriment to the child. Again, because there could be a lot of valid reasons that they're not able to participate regularly or within the time frame of the next hearing. So in closing, and just for clarification, this ACL was to inform county caseworkers of the statute change. However, this is a directive to the courts. Caseworkers are already mandated by existing law to document any barriers or obstacles to a parent's court-ordered services in the case plan notes. So that's already something that caseworkers have to do. This bill was just a directive to the courts. Any questions?
Hey, Todd, I see that we do have a question in the chat. It's from Antoinette, and the question is, will the grants presented be affected by funding issues that have recently come down from our recent administration? And then the second part is, how does small counties that can opt in or out of FFTA affect ICWA cases?
I don't think that applies to my
Okay,
presentation.
sorry, I think it was previous. So perhaps, let's see, Heather, maybe that's directed for you. So maybe you can answer that. So sorry about that.
I believe that applies to my section, ACL 2490.
Oh, gotcha. Okay. So you can go ahead and respond to that if you'd like to go type that in, and then we'll go ahead and bring back Todd and we'll continue on. So apologies.
No worries. That's really it, unless there's any questions. Again, this wasn't anything additional for caseworkers to do than they're already doing. The law was a statute change directive to how the courts interpret the case.
All right. Thank you so much. Our next section is the resource family homes. We have two letters that we'll be discussing, ACL 2469, Foster Care Resource Families and Safeguarding Personal Rights. This will be presented by Kendra Elmendorf. And then ACIN I-3524. This is regards to the CFT CANS deliverables, ACIN, presented by Johnny Cuestas. So we'll go ahead and start with Kendra whenever you're ready.
Hey everyone, good afternoon. So ACL 2469 addresses Senate Bill SB 407, which was chaptered in 2023. It provides notice to county child welfare and probation officers and departments about this change. And this is kind of similar to other ones we've heard. It didn't necessarily change the law. It just was made to enhance the current requirement. So next slide, please. So here are some of the key points of the legislation. The resource parents and resource applicants must have an ability and willingness to meet the needs of a child or youth, inclusive of their SOGI, their sexual orientation, gender identity or expression, willing to accept additional services or supports if the county determines that the family needs more training and resources around SOGI. And the county and FFA must ensure their training curriculum provides training on cultural sensitivity regarding SOGI, best practices for providing care to lesbian, gay, bisexual, transgender, queer, questioning children and youth. So this is really, these provisions were already required through RFA, but this is enhancing those requirements. Next slide. So how is this done? This is done through the family evaluation. That's where it was added in the statute. So the RFA worker, whether it's working with a family going through the approval process or ongoing as they're monitoring the family as they're approved, the worker has to thoroughly explore the family's ability, willingness, and capacity to provide a safe, accepting, and affirming family-based home environment, honor and safeguard the youth's personal rights, and provide non-discriminatory care, with an enhanced emphasis on SOGI. Next slide. It is necessary to assess this, the family's ambivalence, resistance, or denial, and explore their willingness to participate in or accept additional resources and training to learn more about the LGBTQ+ community. So this is if you are working with a family and they have some resistance, some hesitation, some concern, it's really important to kind of drill down and see where that is coming from. Next slide. These are some questions and considerations to go through kind of when working with the family. What is the basis for their ambivalence or resistance? Are views entrenched or unchangeable? And then how will the county continue to monitor the family post-approval? So it's really trying to figure out and work with the family if this is something that can be overcome, if they just need some more training, support in working with with an LGBTQ youth. So it's really, going back to getting to know the family and what support they may need. And the ACL provides information on the bill, but also provides several FAQs. And FAQ number 5 in that ACL provides additional information that is that can help with some questions and things to explore with the family. Next slide. So if you have any questions, please feel free to reach out to the RFA inbox, rfa@dss.ca.gov. And we've also included some other websites, such as the department's SOGI website, as well as one from Family Builders. Thank you. I don't know if there's any questions. Let's see.
I don't see any yet, Kendra. We do have some questions for ACL 2490. So that was the first ACL that we covered. So Monica, maybe you could reach out and respond to those, and then we can cover those at the end again. All right. So we'll go ahead. If there's no questions with regards to this letter, we'll go ahead and move along. So this is the ACIN I-3524, and this is the CFT CANS deliverables. And this section will be presented by Johnny Cuesta. So whenever you're ready, go ahead.
Awesome, thank you. Good afternoon, all. Johnny Cuestas with the Integrated Services Unit in CFSD. And this presentation, so this letter was pretty much a message out of all the work that we've done across different work groups, not necessarily any isolated work group. And the resources are currently available to support counties and using these tools for CQI in preparation for the tiered rate structure. So this can be these could be used to either get some insight into your current practices or support your current practices. Ready for the next slide? Great. So just to list off a few of these resources that we've developed across various work groups, we've made updates to our webpage so that the webpage is more easily accessible from various groups. And we have specific portals for youth, partners, caregivers. And we did this in collaboration with the work group from various partners across different agencies and contracted with an agency with Mark Daly and Associates to make these happen. So our webpage is currently available, and I'll post that at the end of this presentation. In addition to this, the communication work group of the CFT CANS implementation work group, larger work group, also revisited our current brochures. These brochures go over CFTs and CANs for youth, parents, and professionals, as well as privacy brochures as well. And we revisited them, worked with some partners, got the input from the partners, and reissued these that are currently posted on our webpage. We worked with Daly and Associates to update various videos to support CFT CAN's implementation practices. These videos are something that is very interesting to me because I did work in various settings with various groups in child welfare and found that having a video where people can become oriented and informed on the different practices, get a heads up on what to expect whenever you go into these settings, allows folks to get the most out of these experiences, the most out of the CFTs and the CANs process. So we have videos for youth, teenagers, behavioral health workers, probation officers, child welfare workers, that speak on a variety of practices related to CFT practices, CANS practices, and I really want to invite y'all to take a look at those. So those videos are posted in a video library on our webpage, as well as each specific portal. So the specific videos for each group are presented in each specific portal for each kind of visitor that I listed earlier. I'm going to talk about the tribal engagement guide and also the trainings that we've are going to be noticing as well and sharing as well. Ready for the next one? Next slide. Awesome, thank you. So I already spoke on this a little bit, went over the updates to the structure of the web page, went from a format that previously went over CFTs and CANs and training to more of a visitor-specific orientation. So visitors can go onto our main webpage, and as soon as you get to that webpage, you can look at the bottom of the screen and find out which link is most appropriate for you. We've worked with partners to identify which is the most reasonable way, best way that makes sense to organize the different links and resources. So you can see that now. And I spoke about the video library earlier too, where folks can become oriented to different practices. And ready for the next slide. Awesome. And of course, I list my favorite video here, which is the CFT for youth entering STRTP video. And in this particular video, we have a former foster youth who had experience in short-term residential therapeutic programs speak on her experiences and give an overview of what it is to go into an STRTP, as well as what was her experiences using that CFT, and how can the CFT be a useful resource for foster youth going into STRTPs, where they're able to share their experiences, their needs, their goals with the CFT, so that they're able to engage in the CFT and get the most out of that. Ready for the next slide? All right, great. So also the tribal engagement guide was another deliverable that was developed by our unit, not necessarily the communications and messaging group, but this is such a vital resource that we want to message out, and we incorporate it into this ACIN. It was developed in collaboration with our partners from the California Tribal Families Coalition, as well as the UC Davis Resource Center for Family Focused Practice. And it goes over a variety of vital points that cover the essential components of engaging with tribes, practices to be mindful of culture, goes over best practices, as well as requirements for engaging tribes and incorporating them into the practices. Ready for the next slide? Great. This is just a continuation of the last slide. Like I spoke on earlier, just ensuring that we continue to engage with the tribes and ensure that the families, the tribe's voice and choice is incorporated into the various practices, especially the CFT and the CANs, and we're being continuously mindful of the cultural aspects of the tribe, and as they play such a vital role in the case. Ready for the next slide? All right, great. So this slide goes over the trainings that we're announcing. So there is a training work group that went into to making updates to the trainings. And the first work group, the first training goes over a 1-day workshop that speaks to social workers, mental health clinicians, and behavioral health staff. There's no prerequisite, and this it's a one-day training. Ready for the next slide? Previously Module B, this is the previously Module B, the IPCANS overview and preparation for certification. This is the course for that pre-certification course to be administered to prepare folks to administer the IPCANS. Ready for the next slide? And finally, this is the third training that is for it's a 1-day training for social for sorry, this is a 1-day training. It's the IPCANS and supervision coaching staff towards practice integration. This one has a prerequisite of the does have a, I apologize. Let me say that again. This is a it does have a prerequisite, and that is the IPCANS collaborative assessment and action planning through teaming previously module A. Okay, or the other training, the overview and preparation for certification. And ready for the next slide? Oh, great. So previously, there was an active, we did also make updates to the CFT CANS participant survey. It was administered through SurveyMonkey, and we also found that there were updates needed to that survey. So it is now administered through Alchemer and still available through a QR code, which is available on our webpage and all of our deliverables, such as our brochures and I think that's it, just our brochures and our webpage. We've re-vetted these questions, worked with various partners to have the survey more easily like relevant to different populations. So we've broken up each type of survey based on the folks who are engaging in the survey. So folks can enter the survey, find out which group they most identify with, and complete the survey. It takes less than 5 minutes. You can do it on your smartphone, online, and counties can actually access this information. Various counties can use this to kind of see where they're at in terms of how folks are seeing or experiencing the CFTs and CANs process. So we worked with various counties so far and sharing the Alchemer outputs. Some folks have found that it's been beneficial, and folks have been also requesting some of the information in the survey so that they can see how it differs from their own internal processes when it comes to county developed surveys, to see if they want to use the state or county level type version of their survey. So if you have any questions or would like to request your data, if you haven't already received a link, and those links that you receive with access will give you access to your data and live time, feel free to email the email at the bottom and we can get that information to you. There is a criteria. You have to have over 11 surveys completed to ensure that the responses are anonymous. If you have 10 or 9, we're not going to be able to share the information because you don't meet the threshold to maintain the identity, the anonymous identity of the participants who complete the surveys. So just keep that in mind. But yeah, I'm ready for the next slide. So this is a slide of our relatively recent pulls from the data. So you can see in here where folks are you can see the responses of from the question of overall, I'm satisfied with my experience in the CFT meeting. You can see the blue is strongly agree, and you kind of digress onto lower levels of satisfaction. And the second one, you could see, the presentation of the decisions made during the meeting kept in mind the best interests of the youth. So you can see either these responses are look like they're going okay, and these are some types of responses and graphics that you'll be able to receive whenever you request your feedback from your presentation. Ready for the next slide? Okay, so as I was talking about the CFT CAN's implementation work group, so that has transitioned into the CFT IB CAN's statewide forum. So currently we have members of various partners, and this forum is still being held. Counties are able to participate in this this forum, get information from updates on the counties, provide input. These are facilitated by UC Davis. And if you would like to be included or like to participate, believe our email is, we can connect you to participate in this work group, into this forum. Ready for the next slide? And that's it. If you have any questions, feel free to reach out. All of our resources are available on our webpage listed on this slide. And if you have any questions, feel free to reach out. Our email's cws.coordination@dss.ca.gov. Thank you. Or any questions? Thanks.
Okay, great. Thank you so much, Johnny. We'll go ahead, excuse me, and move on to the next section here. So we have one letter under the category of permanency. This is going to discuss ACL 2466, wraparound services paid by AAP, and this will be presented by Zachary Kim.
Hello, everyone. My name is Zachary Kim. Happy Thursday. Happy Black History Month. Today, I'll be talking about wraparound services paid by the Adoption Assistance Program, ACL 2466. So essentially, this ACL is providing guidance on wraparound services paid by AAP. It's one of the benefits that a child may be eligible for and for their adopted parents who receive AAP benefits on behalf of. So the ACL gives a brief overview of the current California wraparound standards, very briefly, and then it also provided a detailed overview of the process for wraparound services paid by AAP. That's to be administered by the counties, and just explains that process. Next slide. So some of the information provided in the ACL, again, a brief overview of California wraparound standards. So all wraparound service providers to receive AAP funding are to be aligned with the California wraparound standards. The current wraparound standards includes the principal phases and key elements that are the foundation of wraparound process. There's more information on our UC Davis California wraparound webpage. And then these standards are created to ensure high fidelity practices in the direct service delivery with children and families, including tribes. So really, the California wraparound standards need to be followed. Wraparound providers need to be aligned with those standards. Next slide, please. And then really the intent of AAP covering the cost of wraparound services is for the temporary resolution of an AAP eligible child's mental health, behavioral health, and or emotional health needs that exceed the child's basic care and supervision needs. Whenever adoptive parents decide to utilize wraparound services for their AAP eligible child, they may make a request to the responsible public agency to increase the child's total monthly negotiated AAP rate to cover the cost of wraparound services. So they just need to make a request to the responsible public agency, and then if everything works out, then they can get AAP to cover the cost of wraparound services. It's really important to keep in mind that the AAP case is between the adoptive parents and the responsible public agency. This is a private paid consumer situation for the parents, and they're requesting AAP to cover the costs. Wraparound service providers should not contact or communicate with the responsible public agency about a specific child's AAP case. Again, it's a private paid consumer situation, should be between the parent and the provider, and then the parent and the responsible public agency. Next slide. And then in order to support a request, when parents make a request for AAP to cover the cost of wraparound services, the adoptive parents need to provide the responsible public agency with supporting documentation to the responsible public agency. The supporting documentation must include verbal and written documentation that is current. And then once they provide that supporting documentation and then the contract that they contracted with their provider to the responsible public agency, then the responsible public agency will assess the request for approval or denial in a timely manner. So the ACL talks more about that process. And then the ACL goes on to really provide guidance on AAP forms that need to be completed, the AAP process that needs to be completed for the responsible public agency and between the parent and them. And then, everything that needs to be provided in order to approve the request. Next slide. And that's pretty much it. It really just provides guidance on the whole process of wraparound services paid by AAP. Adoptive parents can review it, counties can review it, and providers can review it. So please check out ACL 2466. If you have any additional questions, please email us at aap@dss.ca.gov, and take care, everyone.
Okay, great. Thank you so much. We're going to go ahead and go to our next section here. This is the last category under the other and miscellaneous category. We have our last two letters, ACIN I-2124, the California Children, Youth, and Families Integrated Core Practice Model, and the California Integrated Training Guide. And this will be presented by Danielle Moll-Gabry and Chris Petty. The other letter that we're going to cover is the ACIN I-4024. This is the 2024 CWS Disaster Response Plan, which will be presented by Brandy Russell. So whenever you are ready, Danielle, you may go ahead.
Okay, good afternoon, everybody. We wanted to introduce the California Integrated Core Practice Model that has been released. This new ACIN rolls out a revised ICPM, which is really a system of care practice model. It's looking at how the ICPM aligns and integrates key practices and system improvement across the array of other systems. So again, taking into account the entire system of care for this version of the ICPM. The ICPM embodies the shared values expected from California's children, youth, and families being served by agencies within the system of care. And it includes some specific improvements to the ICPM guide and integrated training guide. Next slide. So go back one. The ICPM shares an updated a research-based framework for supporting the children's system of care as a collective impact approach. The revision of the ICPM expands on and applies core practice models and includes new and revised content informed by representative and stakeholders across the system with new information on neuroscience and mind-body research. The ICPM guide, along with its companion integrated training guide, offers a framework to help counties establish effective system partnerships and improve sustainable safety, permanency, and well-being for children, youth, and families while supporting their communities. So here are a number of the ICPM values that are in this version. These values are for all agencies in the children's system of care and are meant to be shared by all who seek to support children, youth, and their families, whether they are employed by a government agency or a community-based organization. So we are working from a parent and youth-driven perspective. Parents and young people are supported in choosing the types of treatment, interventions, and supports provided. with increasing young self-determination based on age and developmental appropriateness. And for Indian children, the tribe is actively involved in decision-making throughout the service and system-level processes. This is state and federal law. Community-based and least restrictive. Services and supports are provided in a home, school, and other community or non-institutional settings, and responsibility for system management and accountability rests within a supportive, adaptive infrastructure of functions, processes, and relationships at the community and regional level. Culturally, linguistically, and equity competent. Agencies, services, and supports are adapted to the cultural, racial, ethnic, and linguistic diversity of the youth and families served. And care meets individual needs, including those shaped by culture and language, and ensure equity in access, quality, and effectiveness of services. And then finally, prevention and early intervention focused. Care is proactive and recognizes the strengths and the protective and resilient capabilities of families and communities, identifying and reducing circumstances that pose risks for healthy development or harm children and disrupt the family. For Indian families, these efforts must include active efforts to prevent breakup of the family as mandated by ICWA. Next slide. Thank you. In this slide, we are going through some of the improvements in this new version of the ICPM. So we've added a prevention focus, adding language reflecting the value and the need to engage early, offer resources and supports, including services based in empirically established programs, such as family strengthening that prevent entry into the systems of care. We added the voice of lived expertise, adding language to support the role and inclusion of parents and former foster youth. A tribal emphasis, adding language reflecting connections to the Indian Child Welfare Act as a platform for effective care and how public agencies should work with tribes in effective ICPM-based service delivery to ensure the protection of rights of tribes and their children. And community-based and provider review. We added reference language about the role of providers in teaming and service delivery. Next slide, and I will pass it off to Chris.
Great. Thanks so much, Danny. Let's take a look at some of the additional improvements that were made to ICPM Guide 2024. In the area of race and equity, there was language added reflecting the value and need to engage early and offer resources and supports, including services based in empirically established programs, as Danny mentioned, family strengthening that prevent entry into children and youth system of care. Another improvement is the inclusion of regional centers. Language was added and the context to highlight the critical role of teaming and planning with partners in the intellectual disabilities, developmental disabilities sector. Ensures the inclusion of services designed to support the specific needs of individuals with developmental or intellectual disabilities. Another key addition was the role of neuroscience. Language was added to support the relational and emotional intelligence demands of staff working in the system based on cutting-edge practice research and the impact of trauma and secondary trauma. And then with practice behaviors, it was updated with specific leadership practice behaviors based on stakeholder input and to more fully align to the 5 elements of care which comprise the model. And next slide. We have two more additions to talk about. 2 practice behaviors were added. We added language based on the National Children and Youth System of Care research and stakeholder input. These principles are equity-based and trauma-informed. And the last addition is Children and Youth System of Care. We added content to firmly anchor the ICPM within Assembly Bill 2083, the Children and Youth System of Care partnerships. As AB 2083 was not law in 2018, it was necessary to connect the practice model as the behavioral glue of the system. Unlike 2018, this 2024 version will be clear that it is a practice model intended for all children, youth system of care partners and contractors. Let's go on to the next slide. All right, I want to highlight some of the examples of how the ICPM guide has more of a system care focus. The first one is the California's hashtags foster stability. The ICPM values and principles are reflected clearly in the state's foster stability work, which represents the voice of lived expertise from current and former foster youth. Safe, stable, resource-rich foster care is a long-standing goal of all system-involved partners. The implementation of the ICPM and the practice behaviors found in Chapter 3 support service delivery toward healing recommendations. And then with health and wellness, healing systems do not re-traumatize, but are thoughtful in all aspects of a youth's life. They also give youth a voice in their options, create the plan together, and not on your own. Relationships are the basis of healing and stability for the youth. In the area of education, prioritize both living and school stability. CFT process focuses specifically on education and individual needs, gives foster youth a voice in their educational decisions, explain the role of educational rights holder to the foster youth, and inform the youth about the California Foster Youth Bill of Rights and Foster Care Ombudsperson Office. And the next one is a place to call home. Home is more than a placement. Generally support the youth's community and sense of belonging. CFTs focus on supporting stabilization in placement and refer to the proper resources. Ensure every youth feels safe and comfortable at any placement. We want to be sure that we're matching living and treatment according to needs and experiences and not just bed availability. And then lastly, lifelong connections. We want to be sure that we're not severing relationships. Through every transition, youth need to say their goodbye and have the opportunity to keep their connections. And co-parenting foster parents and caseworkers should nurture children with their birth parents when possible. All right, let's go to the next slide. All right, let's take a look at the California's Integrated Training Guide. The Integrated Training Guide is a companion document for the ICPM Guide. It is a blueprint for workforce development that's integral to the implementation of the Integrated Core Practice Model and the trauma-informed system of care. The ITG is tailored for shared practice environment and can be applied to any program that involves cross-systems collaboration with families and children. For example, ITG can well support workforce development for FFPSA programs. Next slide. And here we have some bullet points connecting specific additions made to the Integrated Training Guide. It relies on blended audience from multiple child and youth serving sectors. It builds awareness of common practice areas and concerns. It outlines basic organizational functions of collaborating agencies and describes methods for working collectively. It promotes consistent practice standards and values and build a true system of care workforce. It reflects a changing practice environment. And lastly, it utilizes the expertise of tribal and other parent and youth leaders to develop and deliver training topics that reflect their histories and lived experience. All right, let's go on to the next slide, which is questions. So I know that Danny and I just went through super fast on the Integrated Core Practice Model. And what I want to do is copy and put in the chat for you a link to back in October of 2024, the System of Care Technical Assistance Team did a 90-minute webinar on this very topic. So I'm going to put it in the chat. If you want to take more of a deeper dive into what we've covered very quickly today, I'm going to drop that right now in the chat for you. And certainly, if you have any specific questions, you can reach out to us at the icpm@dss.ca.gov email address, and we'll be glad to respond to those questions.
All right, thank you very much, both Danielle and Chris, for the detailed presentation on this topic, and also for the contact information in the chat. So this leads me to the last section of our presentation today. And this is going to talk about ACIN I-4024. And this is going to be presented by Brandy Russell about the Child Welfare Services Disaster Response Plan. Go ahead, Brandy.
Thank you, Karen. Good afternoon, everyone. My name is Brandy Russell, and I'm an analyst in the Disaster Planning and Response Unit. The purpose of our ACIN 4024 was to inform counties of the minor revisions that we've made to our 2024 CWS Disaster Response Plan template and our guide. Next slide, please. Our ACIN was sent out to all 50 our ACIN and CWS disaster response plans are sent out to all 58 counties as a reminder for counties to complete the 2024 CWS disaster response plan. Counties are required to review, update, and submit their county's disaster response plans annually. These plans are typically due to CDSS by December 31st. The bulk of our ACIN outlines the minor revisions that we've made to our CWS disaster response plan template and guide. These revisions included clarifying the language of some questions, adding new questions, removing repetitive questions, and moving questions around to better fitting criteria. Next slide, please. Our ACIN also highlights the CWS Disaster Response Plan Guide. We recommend that counties utilize the guide as a tool to help develop their responses when completing the Disaster Response Plan template. We ask that both child welfare and probation work together when completing the Disaster Response Plan in order to provide responses for both units. And lastly, we ask that counties ensure that all contact information is provided and updated of staff who are overseeing the emergency planning for their counties. Next slide, please. Oh, and this is just a screenshot of our recent ACIN 4024. Next slide, please. And here is the Disaster Planning and Response Unit's contact information. If you have any questions, feel free to reach out to our unit inbox at CWS Disaster Response Plans at DSS. Thank you, Karen.
Thank you, Brandy. And thank you to all of our panelists today. So again, if you have any questions, please feel free to go ahead and put them in the Q&A or in the chat. I'll hang out here for a couple more minutes. And just some closing remarks. I wanted to let everybody know that this webinar is recorded. And past webinars, we also record and we post them to our department website. On the second to last slide, which I sent everybody a copy of this presentation, there are links and QR codes. So we also have all of the CFSD letters and notices right under here where this kind of red call out is pointing to. So if you want to just see CFSD related letters and notices, you can click there and they're all posted. Also, a little quick tip. If there is a letter that you see that has an asterisk in front of it, that means that there has been a recorded webinar on that particular letter. And you can find those recordings right under that link under the CFSD Quarter Policy Guidance webinar. These are where the recordings are posted. So this recording for this particular webinar will probably be posted tomorrow. If you don't see it, you can always reach out to me. There's also links down at the bottom where you can find this information. And then lastly, just thank you to everyone who participated today. Our next policy guidance webinar will be scheduled in June. If you are not on our distribution list, there is a URL where you can sign up to be notified of future webinars. And one more quick note, I think I sent out a reminder to everybody, but just to reiterate, there were 2 letters scheduled for today that we've moved to our June section. Those letters have to do with the transfer of tribal youth from counties, transfer of tribal youth from counties, and then also voluntary and involuntary proceedings. So far, those 2 will show up on our next webinar. If you have any questions, please feel free to contact me. And I thank everybody for joining. If you have any comments, questions, please reach out and we'll get those handled as soon as we can. There is a message that came in from the chat from Kim. Is it possible to link the CDSS page with the recordings and the webinar sign up in the chat? Yeah, actually, let me go ahead and I'll back out of the view here, my regular view, and I'll just copy these here for you. So in the chat, the first one is the letters, and the second link here, I'll go ahead and put in there as well. All right, so those 2 links are in the chat. Good idea, thank you for that. Let's see, and the sign up, I'll put in there as well for the webinars. This is the last link where you can sign up for future webinars. All right, I'm going to mute myself. Like I said, I'll hang out for a few more minutes if there's anything you need. And once again, thank you all so much for your time today, and we'll see you next time.